So may I call upon stage the moderators for the next session, Dr. S.K. Pal sir and Dr. Keshav Murthy sir. So there are various options available. Is Keshav Murthy sir. So I may have an option of joining government practice, corporate practice, only clinic with roaming practice, or owning my own nursing home. So it is a sort of balloon debate where we'll understand the plus and minus of each aspect, and which helps us to understand which best suits to me. Thank you.
Yeah. Can I invite Dr. Anup Gupta to talk about government practice? Anup, can I request you to be on time?
Sir. Good afternoon, respected seniors, my dear colleagues. I want to again thank Dr. Desai sir, Dr. Samni sir, Dr. Rajesh, Dr. Abhijit and the whole Vice Zone USI Council to invite me for this wonderful conference. And it's really my pleasure to visit this, the temple of knowledge I call it. Whenever I come, I learn a lot of things. So I am in the government practice for last 18 years, so that's why I have been given the task. Uh, so whenever our young urologist he pass out under DNB and MCH, what is in mind? He wants to have professional growth, he wants to have personal growth. When you talk about professional growth, we should have a surgical growth, like we should learn more new procedures, like the debate is going on. We should also have improved understanding of the various urological concepts. And of course, we should have greater recognition amongst peers, which is again everybody wants. And financial stability and growth is of course in our mind. And then personally, we want family creation, family growth, more time for self-family, and settle down, of course, finally. So, I think these are the important points every young journalist when pass out should have in their mind. First, to learn complex surgery is not a very easy task, like we were already discussing. It has to be gradual, stepwise learning, number one. It has to be selected, you have to select your patients very wisely. You need to assist first many cases, then you graduate to actually do the cases. You should have a good infrastructure backup. Of course, you need a good experienced surgeon as a backup or doctor or yourself. And of course, most important is to ensure your patient safety. If your patients are not safe, not doing your job. Now, why I advocate government practice is good, like because you can have surgical growth. You can have a gradual stepwise learning, which is safe for the surgeon as well as for the patients. You join, I'm talking about an academic government institution. When you join any established institution, you start with simpler cases, start with simple lab, simple nephrectomy, or dealing with hortomy, and then you graduate to the complex cases. Initially, you assist your professor in the complex cases, and then you gradually take over. And as experience improves, you keep on doing complex cases. It gives you an opportunity to select the cases. Like I said, you can have simple cases and your boss will do the complex cases and gradually you take over. And then, of course, you are learning the procedure not at the cost of patient safety. You have a good backup in all of them. I'm talking about the good government institutions. You have good backup of all interdepartmental faculties, ICUs. And if anything happens bad, you can have their hand, they have their backup. And that means you have the daring that you can go for some difficult surgeries which are not possible maybe in a smaller institute. And then of course, we are talking about subspecialties. I think this is it has to happen. You have to accept this. And subspecialty practice can be developed if you join a good government institution. Because in a department, you have different faculty. Each of them can pick up their own choice and they can develop various subspecialties. You can go for different training programs while you're in the government practice, and you can develop your subspecialties. Like I'm fortunate enough to visit Dr. V.P. Patel as a clinical fellowship, and it changed my direction of my career. Now, of course, government centers are the teaching centers. As a young neurologist, whether you have done the MCH or DNG, you still require more advanced understanding concepts of different neurological diseases. And in government practice, hospitals, you have daily discussions of the different patient cases. Regular classes are happening, and you learn while you're teaching your students and your younger faculties. Of course, you have better opportunities because you can do research, you can publish, and of course, you can organize conferences in a better way, like live surgery conferences, and of course, you can go for fellowship, I said, and you can develop your leadership qualities while working in a government academic institution. So, like we started our live surgery workshops 6 years back, robotic and 3D labs, and then gradually we progressed to more live surgeries all across the country and of course across the world also. And we were appreciated by our health minister. So this is just, I'm showing a glimpse. It can happen. We finished our 200 live webcasts and then we showed a live robotic transport. So this is something which can happen to anyone who is in dedicated government institution, but you have to devote your time. We started tele-mentoring and tele-proctoring also. And now this is the era of telesurgery, and this is going to come in the next few years. Of course, financial growth is very important, and what I say in government practice, finances tend to grow, but at a stable, peak-related fashion. And like Dr. Subnis said, you should not be too greedy. You should invest your money, whatever you want, in a proper manner. So you have added perks like you get a houses at subsidized rates, you get some travel allowances, you get allowances to attend conferences. So of course, you have financial stability, which is the key in government institutions. And of course, this is something which I like, a work-life balance. This is something which we miss when, especially we're doing our residency programs. So in the initial part, we still want to see our family growing, kids growing. We want to spend quality time. After 13 years of this struggle, we want to settle down. And I think government practice, you can do that. You can develop your own hobbies and you can devote time to you, can heal yourself. And that's what I started doing all these things. So, as I said, you are having MCIT programs, you are teaching them, and you're actually upgrading your knowledge also. So therefore, this is something which you're learning throughout your career. And then you can have some new cutting edge technologies you can add to your armamentarium while in the government institution, because you are having the backup of your seniors. You got to do social service to the society, because we all are trained in a government institute where we were funded by the government. So it is our turn to give back to the society. And therefore, if you work in a government hospital, you are serving underprivileged patients. So this, I think, you're serving back to the society. This also gives you a lot of satisfaction. Finally, I want to say that if you decide to join an academic government institution, this is a win-win situation for you, because you have a safe and consistent surgical growth. You have opportunity to advance urological concepts and continued learning. You can practice the specialty as you grow along your career in a government institution. You have stable finances, consistent and predictable growth. You don't have any uncertainty that you can be fired out. You can serve your society, and I think most importantly, you can give back to your own faculty. You can contribute to the training of your younger colleagues. I think training is something which is very mandatory, and in government institution you can continue doing that. Thank you very much for your listening.
Thank you, Anup. You have highlighted why you have joined the government service. So let's see what Harish has got to tell about corporate practice.
So, good afternoon, everyone. First of all, I would like to thank West Zone Council, Dr. Abhijit, Dr. Sabnis sir, for giving this opportunity. So here all we are gathered to convert some data and information into insight and wisdom, with connecting dots, so that we can take home some message which may be helpful in our day-to-day practice. That's what the purpose of this kind of conference. So I'd like to share some of my experience over the last 15 to 20 years in more than 25 different corporate setups where I observe, I work. After 14 years of schooling and 13 to 14 years of intense medical schooling, the seminal question arises, what next? And there is an interesting trend towards joining corporate hospitals by juniors. So this presentation is overall idea for youngsters who wish to start his career in corporate setup. If your niche is quality of care with latest equipment, then there is no matching with corporate hospital practice, that I can say. There is increased rise in private hospital chains across the India, and you know the urology is a key specialty because of stones, prostate, cancers, and transplant. And insurance and medical tourism fueling patient flow into corporate setups. So how to enter in corporate setup? There are many three ways one can enter in corporate setup. First is if you are doing fellowship in corporate hospitals, you can continue after completion of fellowship as a consultant. Then there is a direct consultant recruitment with agency. And third, if someone knows you in corporate setup, they can refer you in a corporate setup where you want to work. The main three factors are considered like skill, reputation, and communication in a corporate setup. The major advantage of working in a corporate setup is strong infrastructure and availability of latest equipment. The second most important factor is there is an organized workflow. So there is a set protocol for every procedure. So you can predict how patient outcome is going to be. Third, you have minimum amount of guarantee in most of the corporate hospitals. So you can have some financial security. Apart from this, you can treat complex cases with multidisciplinary approach and less admin work related headache. These are the main advantage of corporate hospitals. The challenges. Main problem with most of the corporate hospitals with few of the consultants is targets. But it's not for all of corporate hospitals or all consultants or all urology doctors. And initially for junior consultants there will be limited autonomy to practice at least in the beginning phase. And obviously, if you are too much into it, there is a risk of burnout in corporate hospitals. So typically, the salary what you get financial is 30 to 60 lakhs on an average to a urologist in India currently. But it may vary from 18 lakhs to more than 3 crores per annum even. There are various three setup for corporate setup that they give incentive. First thing is incentive plus they give minimum amount of guarantee plus incentive. Second is fixed salary. Every month you get fixed salary like government setup. And third is only incentive based. So depending your contract, you can choose which is more suitable to you. It varies according to which area you are practicing your corporate hospital, whether it is in tier 2 city, tier 1 city, urban or rural area. The main key focus in every corporate hospital is patient-centric care. I would like to caution for all youngsters because corporate hospitals are for business, but as a doctor we are for patients. So patient-centric care should be kept in mind all the time, and we should avoid unnecessary any kind of procedures for our patients. We should be very transparent about billing, which is main problem with corporate hospital at all the time with our patients. And sometimes we need to handle the VIP kind of patients, which are very common in corporate hospitals, little bit differently rather than what we treat the patients. Career growth, you can have career growth like Anup has mentioned, like academic institute. You can develop subspecialty like andrology, robotic, uro-oncology or endourology in corporate setup. And interdepartmental or intra-departmental like urogynecology, you can start urogynec clinic and urogynec specialties. That option is valid in corporate kind of hospital. If we compare with private and academic institute, infrastructure and income-wise, corporate hospitals is more favorable to newcomers, while freedom and research and teaching may be little bit less as compared to academic and private setup. So these factors one should keep in mind while choosing the option after passing MCH or the urology. Let's quickly go through 15 must-know points for youngsters while choosing the career option after passing MCH. First thing, you should be very clear in your mind how long you are going to stay in corporate hospital. Just to buy some time before you start your private practice, or you are going to stay in corporate hospitals for a long time. So one should be very clear in his or her mind. While negotiating contract and salary, you should be very blunt. Make sure that you are worth whatever you want to expect salary. You clearly talk to your interviewer. So this should be kept in mind. Negotiate your worth. Understand each and every line written in your contract. If you don't understand, please show it to your senior colleague or maybe advocate. So later on you don't land up in trouble, legal troubles, what I mean to say. Build your surgical reputation gradually. When you are newcomers or junior guys, don't do any heroic surgery while you are in corporate setup, because safety of margin or error is very narrow in any corporate setup. Outcome is the most important factor in any corporate setup. Focus early on subspecialty. If you are interested in stone, focus on stone. At least beginning, so you can start after 5 to 10 years to that particular subspecialty. Learn to balance between clinical care and business expectation. As I mentioned, corporate hospitals are business oriented. They want business. But you have to learn balance. Doing ethical practice and maintaining the balance. That is the key. I strictly advise all youngsters, you should not compromise the ethics and moral of medical care at the cost of business for any corporate setup. But you need to learn how to develop business in an ethical way. That's the most important message for youngsters. For that, you should create your referrals. General practitioner, family doctors, physicians, social leaders, workers, and you should create your own network to get patients. I strongly recommend every junior consultant, you must attend CME. As this has mentioned, life is all about learning all the time. So even if corporate hospital doesn't support you, you should attend whichever specialty you are interested and learn something new every opportunity. Invest in professional branding. The corporate hospital do advertisement for their branding, but you should start developing your own branding, whichever specialty you are interested in. You need to learn the digital platform because most of the corporate hospitals, they have digital documentation for all patients that you should need to learn. One need to learn and maintain the data and surgical outcomes and do audit of your own patient frequently. So that will help to improve on yourself and that will help to ask new instruments from the corporate management. Find a mentor inside the corporate hospitals. Whenever you need some help or need some guidance, you always need to contact your mentor. Burnout is a major problem in corporate sector, not in healthcare, everywhere. But you need to have your own strategy how to avoid burnout, and if you develop how to come out of that burnout, that's very essential in any corporate setup. The patient communication skill is sometimes more important than surgical skill in corporate setup. So that one should need to develop. It doesn't help. If you are academically oriented, corporate hospital has less opportunity for academics and research, but you need to develop collaboration with other institutes which are academically interested. I had collaboration with the Home Science Department in MS University. We did one study in diet and stone and we presented in USA and won first prize during 2021. So that kind of, so be novel and innovative because corporate hospitals sometimes in beginning phase you will have basic cases, putting digestion, you remove the digestion, you do URS, PCNL, RRS, that's all, or prostate surgery. But you need to develop some innovative technology in your practice to avoid monotonousness of practice. You need to carry out some awareness activities to convey a message that you are not only money oriented or you are not only business oriented, and some kind of definitely charity work. I have done more than 7,000 Ayushman patients when I was in corporate hospital. Awards and recognition, as morning I think very well documented. Awards and recognition, if you are willing to get it, but not paid awards and recognition, that I strongly object. As a doctor, we are not only treating patients, but we are academician. We do some research, training, education, charity, and awareness programs. So, to all my youngsters, key tips: stay ethical and patient-centric. Learn hospital systems. Avoid admin conflict. Very important. Document surgeries and outcomes. Stay updated. Skill workshop and technical upgrade. Mental resilience is crucial in corporate setup. To conclude my talk, corporate setup is well structured, viable and rewarding. Challenges exist but can be managed. Focus on reputation, skill and communication. Adaptability is the key to long-term success in corporate hospitals, and please do not compromise ethical work at any cost in any organization where you work. The most important thing is it's not important what you are getting, whether 3 lakhs or 3 crores, but what you are becoming at the end of the 1 year, 2 year. So one should introspect oneself, what I am becoming. Am I losing my creativity? Am I losing my interest in research? Am I losing my interest in academics? That's the key point when you should decide where to go, corporate, academic or private. Thank you so much giving this opportunity.
Thank you very much, Harish, for making your points in favor of corporate practice. Now let us call Dr. Akshay Kripalani to tell us about only clinic with roaming practice.
Thank you, sir, and very good afternoon to one and all. I am Dr. Akshay Kriplani from Nagpur. And before I start my talk, which I think is very frequently booed on and not well accepted in amongst our society, which is fine. But idea of this topic and is of this conference as a whole is not to pinpoint on what is right, what is wrong, what is good, what is not good, but its idea is to understand what are the different types of practices and what might be good for a young urologist who's fresh starting, and maybe take home some points of this is for them or not. So let's start by understanding that yes, before we call ourselves a urologist, already about 30-31 years have been passed out, and this is if you get everything in one go, and if you have taken some preparation breaks for your entrance exam, you have to serve something which is unavoidable like a bond or a mandatory period in the hospital, or you are trying to do some fellowships. You are easily about 35-36 years old by the time you have completed this process. So at the end of your 36 years where you've lost most of your prime youth is a time where you now realize and you have to understand what you actually want from your life. This is a time when you sit back, think that what is it exactly that I want? Do I want a teamwork, team practice where I can have some juniors helping me, some seniors guiding me, or I want to go full throttle in my practice and just take as it comes and earn money and live my life, or have a good money doing clinical basic urology work, or want to subspecialize and do specific work. These are the questions that you should answer now, and by the time we should understand that our training institutes now are of such quality that by the time you finish your training and the bond and some fellowships, we have some exposure, some experience and basic confidence to start our life and then do some basic common clinical urology work. So if you are confident to take on the world head on, you start your own practice. If you feel that you don't have that level of confidence, you can team up with your colleagues and then join hands and join with like-minded people and work together so that you can help each other. So the topic for today was whether to get into different types of practices. So the topic of government setups. Well, first challenge of a government setup is to get in. We all know getting into a faculty post in a government setup is not as easy, right? First problem is the vacancies. There's hardly any vacancies in the government setup. There are so many bonded candidates which are already labeled as assistant professor. So getting into a government setup where you are not bonded is difficult. Number one. Number two, you want to have a permanent faculty post. You have to write exams. You have to qualify, and not necessarily you will get in your own city or your own state probably. There are many unspoken hurdles. We all know the selection process in our country. Maybe you deserve it, you won't get it, we'll not get into all that, but getting into a government hospital is not easy. Now once you're in, you have to understand there is a hierarchical process. Okay, so there is, if you expect that I will get into a government hospital and I'm going to work day in and day out and I'm going to learn a lot of skills, it might not happen so soon. You might take a couple of years, maybe more, to get what you're trying to achieve. Because getting independent work doesn't start in the initial few years probably. There's a hierarchical system, so you have to work accordingly. Like sir mentioned, initial cases is just common basic and you have to observe and then you have to assist, check on wards, etc. And there are limited working hours in a government setup. So how much, and there are so many people in the department, so what you get eventually is not what you had expected. Moving on, so there are limited resources. We understand government setups have their own limitations. You might not get the best of advanced technology in urology. Maybe something you were looking for when you passed out your setup and you did not have it in your private training courses, and you might not get it in the government hospital of your city. So, and there are multiple users. There are different faculties. There are juniors. There is wear and tear. Replacements always a problem. Repair maybe not. Work environment. Okay, so if you have a department which is very laid back, your bosses or maybe your OT technicians and the ward sisters are not as enthusiastic as you are. Their mindset might be infectious. You might feel that I'll spend 3 years in a government setup, maybe after that I'll go on and take on the world. By that 3 years, your mindset might also be a little slow. So it affects, the mentality affects each other. So maybe you can get slower. Obviously there is limited income if you are sticking only to a government salary. Obviously, if you are in a 3-tier city, your expenses are much more than what you earn. So growth is slow. Your operative growth, your personal growth, your operative skills, by the time you learn that many surgeries, financial growth is slow in this kind of a setup. So should we go on to a corporate setup? Well, corporate setups, yes, you are a slave of the management. Your head of the institute is not a doctor. He is an MBA who's telling you what to do, what not to do, when to come. You are, every move of yours is monitored. When you come to the hospital, what time have you seen a ward consult? Why are you so late? Why are you sitting in the cafeteria? Everything is monitored. You might know it, you might not know it. If you are a junior consultants are the easy targets. Your senior bosses are the major revenue makers of the corporate setup. They are also scrutinized, but less as compared to you. So if you're a junior consultant who's trying to join a corporate setup, you will be monitored and you are the easy targets. So yes, performance pressures. There is immense pressure on you. You are supposed to bring patients to the hospital. That is a part of your salary. Turnout time. The patient came at 9 a.m. You saw the patient at 10 a.m. Why had the patient to be? Why did the patient have to wait for an hour? Same goes for ward consultants. So turnout time is a reality, and you have to answer everything at the end of the month. Availability. You have to be available. If you're a junior consultant, you have to come for emergencies. You have to do everything. You have to be available round the clock. Yes, it has to be depending on your agreement. Targets, yes, you have to finish your targets, and you are responsible for revenue generation of your department. There is hardly any time for academic growth because you are busy doing all this. Yes, the hospital has to be bigger than the doctor. The hospital will never promote you. They have a lot of promotional activities for them, but patient comes on hospital's name. The patient does not come on your name. You will not be allowed to be promoted if you do a major surgery or whatever. So the credit of good work goes to the hospital, and the maximum profit is of the hospital. Corporates are cruel. You are very unsecure, and you are easily replaceable. You ask for a hike, there is always be somebody who would be willing to work for much lesser, and your seniors are preferred than juniors. So you move on to have your own hospital. This is the solution, but there is a heavy investment. We all understand. Building our own hospital requires double-digit crore rupees. It is extremely stressful. You have to manage. You have to bring in your own patients in the era of yojanas. Everything related to IP care, OP care, emergencies, running expenses. We talked about litigations. Everything is your headache. Managing hospital staff, it is a big pain. Training them, managing litigations, we discussed. It is not easy to run your own hospital and with untrained staff. Compliances, licensing, it's a completely different ball game. There are a list of compliances that one has to fulfill. So what is the solution? Let's find a midway. If you could get your own clinic and do roaming practice, maybe life is easier. So if you have a OPD setup, which you can either rent, buy, or maybe share it with someone, there are much less permissions required. There are easy licensing processes. You have much less infrastructure that is required. Staff requirement, hardly a sister and a nurse and a receptionist can do the job. Maintenance is very, very easy. You can have your own patient base. Patients come on your name. Your name is...
Akshay, you have 1 minute to go. Akshay, yes, 1 minute to go.
Yes, sir. Yes, sir. You get recognized because these patients you are managing. Your name is written on the board outside along with your hospital's name. So your identity builds. You are the own boss. You can have a laboratory, radiology, flowmetry, urodynamics attached. You can do minor procedures, and your revenue is you can have a turnover very fast. Freelancing, you have a wider pool of patients you can cater to. You have a variety of cases which you can cater to. You learn a lot of tips and tricks when you visit a lot of hospitals. You learn from these OT technicians who've been working along these years. There is never a lag phase at work. You have constant operative work, and obviously freelancing, you earn well. You have a constant source of income. You can admit patients in your agreement where you have an agreement with hospitals, and the hospital manages everything. They manage the patient's admission, IP care, OP care, the billing, the follow-up. You have much less stress. So there are a lot of perks. You can choose your working hours. Your good work makes you popular in the society, and these patients, the word of mouth brings you more patients. You have enough time for academics and research. Financial growth is fast. You have time for your own self, your family. You can have recreation and take vacations whenever you want. Advisory, you have to choose your hospitals very carefully. Beware of unethical practices. You have to learn to say no. No unindicated surgeries, come what may. Take responsibility of your patients. Do go back and see your patients, not just operate them and forget about them. Do not compromise on patient care is the take home message. So own clinic and freelancing is a blend of your work satisfaction. You have time for academics and research. It gives you a quality of life, and it has a good personal and a financial growth. At the end of the day, wherever you are, I feel your sincerity, skills, smartness will give you success, be it in any kind of institute. Thank you very much.
Thank you, Akshay. Now I call upon Dr. Kaushik Shah to talk about own nursing home. Kaushik, you have 8 minutes. You have 8 minutes for your talk.
I'm thankful to the West Zone and Multi Patel Yoga Hospital. I'm born, brought up in Nadia, and this is my home place, and all what I learned, a lot of credit goes to the hospital. Next slide. So what today in last 1.5 hours discussed whether to do super speciality, sub speciality, whether we start private practice. All can be possible if you have own setup. So the choices are plenty: corporate hospitals, clinic, nursing home. What? Next. So, what exactly is degree? You. So, my professor told when I passed my MS with gold medal, Kaushik, you are not mastering all surgeries. It is just a license to learn surgery yourself without supervision. We believe that you will learn without harming the patient. First, do know how. Learning is an ongoing process. Next. So, after passing my MCH Urology, lot of things goes in mind, and it has to be informed decision. Whether I want to go back to my place, where I want to start my life. There are so many priorities in your life. You have spent 30 years in your life just to start creating a resource to learn your life. So set up your goals. What are your immediate primary goals? You have a strong desire to earn because you have spent a lot of. But after passing MCH Urology, you feel that I am allowed to fly in an open sky, but I don't know how. I don't know what will I do. So in that state of mind, you decide, and then again, you may not have a resource to start your own private setup. And there are limited places to work, like in corporate or government or every place. The question what to do now. Few things to remember to reduce your anxiety while taking an informed decision. There is nothing right and wrong. There is nothing like a free lunch. There is always plus and minus of your decisions. One can always switch over from one type of practice to another, and one can have multiple combinations of the type of practice in real life. We have a number of people, surgeons who have in private practice and in academic, in corporate, in teaching, in research, in an institution, and I can name every one of them. So the decision making process is the most important before you embark your journey, because it is going to decide where you will end up in your life. So first thing is probe your inner desires. What is that is going in your mind? Do you want independence? No interference from others in your work? Then government, corporate may not be your choice. If you want to wish to have freedom to work or not to work, want to take a leave at your own time to chase your dreams of life. If you do not want to chase the target given by someone else, if you do not want to work for others or under someone, if you want to be a freedom for jugaad or use innovative ways to do the things the way I have done, if you want to learn a new speciality because the flow is suggesting that there are a lot of work, there are a lot of unmet needs of your society, you can develop in that your field. and whatever money you get, you can spend in an area of your interest, and there is freedom from other responsibilities. There is a freedom to do charity and charge if you wish. If you think that your parents have said that you are doctor, you are supposed to serve, you have to serve. So if these are the things that is going in your mind, then first define your short-term and long-term goals according to your inner instincts. Evaluate your capabilities like hypospadias, competency and aptitude by choosing that goal. Are you competent to manage varieties of cases? Are you confident to manage the patients and relatives and expectations as a social skill? Next. Now comes the decision. Do you have professional competency? Do you want to go in for hospital management, financial management? Are you willing to take the legal compliance and dealing with the semi-government government bodies? Then your choice is your own nursing home. Now let's know more about it. The advantage is you create your own space, though it may be limited and it constrained as per your need. OPD and OT hours are at your need and your comfort. You can start OPD in the early morning, you can start late night, you can operate wherever, whenever you want. OPD and OT are usually nearby, not at a faraway distance, like a roaming, and lot of times are spent from transporting. I have seen number of people who have died during the transport during the roaming practice. Then you don't need to wait for your turn to do the OT. Staffs are under your control. No one is going to say anything to them. They will follow what exactly you are saying, and you can train them as per need. And over a period of time, they know what you need, what your patient needs, and lot of burden goes away. There is always a consistency of staff over a long period of time. You keep retaining the things that are working, and you keep relieving those who are not there. Within 2, 3, 4 years, you will get a staff which is going to be with your rest of the life. And when whatever fees you collect is your net collection, not net income. So the growth pathways are, you have a freedom to decide your charges as per the market forces. You can do my Yojana also, you can do corporate, you can whatever charges is possible from the patient you can collect. Your staff and instruments are a boon in a rooming practice. Rooming practice is an essential part of everyone has done a rooming practice. So every one of us has done a roaming practice, but that was not the end of it. That was the beginning of our career. And with a suitable attachment of a multi-speciality hospitals, you have a freedom to decide whom to operate your center. You need not create a hi-fi centers. You can go there, you can operate whenever there is a high-risk patient, multiple problems. You have a choice to do it. And if you want to spend more time, then you can take up a government setup attachment, corporate setup attachment, higher setup, research institutions to fulfill your dreams and passions. I know a number of people, sir started in Ahmedabad and then he developed his research institute. He started private practice and he has grown in a sub-speciality across the world. So everyone has, Dr. Ashish Patil, he has his own institute, medical college, corporate hospitals, chain of hospitals and research. So everything is possible if you are doing on your own. And there is a freedom to invest your earning in an area or in an instrument. You don't have to ask that this is what I do. When I was talking to Prashant, he said, I am doing whatever things I want, and I am having it and I am completely satisfied. And everyone is saying, with an eye of respect. He started practice in a very small town. But there are challenges. You are the investor, you are the hospital manager, you are the marketing person, you are the professional. So you count your earning as an investor in the hospital, as a manager of the hospital, as a professional urologist. And there are a number of compliances to fill, but the life is such that we have to fulfill the laws, and it's not difficult. Only thing, you have to have a slightly bigger heart to understand that yes, these compliances are needed for the patient safety. They are not the burden, they are the support to provide better care services. Now there is a Another challenge, that is limited availability of to get a qualified staff, and if you get a qualified staff, there is a limited ability to pay. You cannot have MBBS doctor, you cannot have qualified full staff in your setup. There is a limited capacity to charge the patients. You cannot charge the way the corporates are charging. There are a lot of legal challenges to run a hospital, and if something goes wrong, all the blame goes to us. He has said that when we were doing whatever things happening, and then from a very small center he has become a corporate. He is hiring and doing wonderful. He has expanded in all possible fields, in education, in work, in professional teaching. So it is possible to expand in whichever area we want, but if you are doing only in a small center, then there is a limited capacity to take challenges, and the answer is you take an attachment to a corporate hospitals. And if you want to plan holidays, you have to plan or develop a rapport with a colleague who can take care of your hospitals in your absence. Now, coming to the income, people say that when your own setup is there, there is a lot of income. It's a myth. Whatever patient pays to the hospital is your inflow, not your net income. There are a lot of overheads to pay them. You are working as investor, as mentioned, manager, market person, urology. Most of the hospitals do not get more than 30-40% as a net income. If you work at other places, you might be getting 15 to 35%, so you don't need to bother about that income part. And whatever you earn, you keep investing in your own profession. You use your money to grow yourself. So now that you have decided to achieve that aim, let's start how. If you are not competent, be competent.
Kaushik, you have got 1 more minute here to conclude.
1 or 2 minutes. Because once you decide how to achieve that aim, start with only roaming practice. 1 minute. Own nursing home, group practice with other colleagues. Balance. Don't buy premises. Always on a rent because it becomes much cheaper. Buy all good quality instruments. Lasers, you are the king. Plan your OPD, OT. Choose the way you want to treat. Charge or not charge. Take holidays. Invest where you want. Spend time where you want. Growth lasers. And be happy. The downside is that if you have developed all these and if there is no one to look after, then whole setup goes west. So always try to enroll some juniors in your own setup when you want to retire. Thank you.
Thank you, Kaushik. We'll not have any questions for this session. No questions for this session because all of them have shown the points. Point counterpoint was there in their slides. So no questions. I thank Abhijit.
See, after practicing for 35 years in Delhi, where I didn't know anybody, I joined Delhi just because there were about 10-20 C-arms there in Delhi. No other city in 91 had so many C-arms. So after practicing, now I can put it everything in the right perspective. For the first 10 to 15 years, from 30-year age to 45-year age, you should have your own clinic. Run from here and there, spread your name, show your work to different hospitals and nursing homes so that you are known in the city. Then patients will start coming to you. Once you get 10 to 15 patients every day by the age of 45, then you should own a hospital. Because he has not rightly said, even you start making money from the parking lot when you have your own hospital. A 9 rupees bottle of normal saline is sold at 27 rupees. Where else you will make 300% profit. So enough money is generated from 45 to 60 years of age. Make your money whatever you want. And that time you had seed money, so you can own a hospital at 45. After 60-65, then you should join a corporate. As Kripalani said, that seniors are not screwed that much. And they need you for starting their DNB programs. They need you, they will call you. And you have enough number of patients coming to you, so they need your patients also, so that you get MRI and CT done in their setup. So this is how, if you see private practice, you can enjoy the full private practice, all the spectra of private. Thank you very much.
It is well summarized, sir, and it is a good take-home message for all the urologists, younger urologists over there. I would I would like to thank all the speakers of the sessions and also the moderators for the session.